Welcome to the deep dive. So today we're looking at something that, well, it really touches everyone's life. Healthcare quality and patient safety.
It really does.
We've pulled together a pretty interesting stack of sources for this deep dive. It covers everything from, like, the big picture global standards, accreditation bodies.
Right, the system level stuff.
Yeah, all the way down to some surprisingly specific hands-on advice for navigating surgery and recovery. Very personal.
And what's really interesting, I think, when you look at this material together is how it kind of highlights two sides of the same coin. You've got this high-level organizational push for quality, the standards, the inspections, all that.
Right.
But then you see how those big ideas translate right down to the individual patient. Makes it super clear that system quality isn't just abstract. It's about your safety, your outcome, especially with something big like surgery.
Exactly. So our mission here
Just unpack it.
Yeah, exactly. To unpack what these sources are telling us about why quality is so deeply important in healthcare, and maybe more surprisingly, why something as seemingly simple as patience, just being thorough, is absolutely critical when you or someone you care about is facing an operation. Okay, let's dig in.
Yeah, let's kick things off with that global view. The Joint Commission International, JCI, comes up a lot in these sources.
Right.
They're positioned as a major leader in healthcare quality, patient safety worldwide. Their mission statement is pretty straightforward. Push for and confirm the highest standards for everyone, everywhere.
And they're not small. The sources say, what, over 70 countries?
Yeah, 70-plus countries. They've accredited and certified over 1,000 programs.
Wow.
And they use something like 600 experts. It's a significant operation.
Okay, so what's the real point of these standards? This is where it gets interesting. The JCI sources talk about rigorous international standards, and specifically these international patient safety goals. Why those goals in particular?
Well, according to the sources, it's because they're aimed squarely at what they call problematic areas of patient safety.
Okay.
The common risks, the things that tend to go wrong more often in hospitals.
Yeah.
It's about identifying those weak spots and building systems to, prevent harm before it happens.
That makes a lot of sense. But why would a hospital want to go through all this? It sounds like a lot of work. Here's where it got really interesting for me.
Yeah.
The sources list some pretty compelling benefits. Beyond safety, they actually call it a great team-building exercise. You can see how that would improve how people work together in a hospital, right?
Definitely. Communication, coordination.
And they mention a competitive advantage, so there's a market aspect too.
Absolutely. And that probably links directly to strengthening community confidence, which is another benefit mentioned.
Right. Patients want to feel safe.
Exactly. And accreditation is a signal of that. Plus, the sources point out it helps improve risk management and risk reduction. Finding problems before they hurt someone. It helps organize and strengthen patient safety efforts, and really importantly, fosters a true culture of patient safety. That JCI Gold Seal of Approval isn't just symbolic. It's presented as signifying a real commitment, adding tangible value.
Now, let's bring it closer to home. The sources also mention the Indian context, specifically NABH, the National Accreditation Board for Hospitals and Healthcare Providers. They're part of the Quality Council of India, and basically doing a similar job to JCI, but focused locally, right? Setting benchmarks, running accreditation here.
Precisely. So you see this parallel structure, global standards, national standards. Both exist to drive quality and safety using clear benchmarks and independent evaluations. It's about accountability, pushing for constant improvement.
Okay, so now let's connect these big system goals to something really practical for you listening. A really strong message comes through in those patient-focused sources.
The surgery and recovery ones?
Yeah, the mindful surgery, navigating recovery, the lifelines guide. It's this crucial point about not rushing the process of surgery. And that means before and after.
And this is where, like you said, it connects system quality right to your personal health. The sources are very, very clear on why rushing is so risky.
What do they say?
Well, trying to skip steps beforehand or pushing yourself too hard too soon afterwards, it seriously increases the chances of problems. They specifically mention a higher infection risk, especially if you strain the surgical site.
Right.
Which then leads to prolonged healing. So ironically, rushing can make recovery take longer, and there's a greater risk of re-injury because the tissues aren't ready.
And the sources say ultimately rushing can even lead to poor results for the surgery's success in your long-term health.
Exactly. It's not just a small setback. It could undermine the whole point of having the surgery.
It's a really powerful reminder that quality healthcare covers that entire journey, doesn't it? Not just the OR.
Absolutely. So let's focus on that time before surgery. The mindful surgery and lifelines sources talk about this. They make a helpful distinction. There's emergency surgery, immediate, obviously, urgent needed within days, maybe for a bad infection. But then there's elective surgery, the planned stuff like joint replacements, hernia repairs. And the key point is that elective surgery, and often urgent too, gives you that crucial window. Time to do things right, time not to rush.
And the sources are really firm on this.
Yeah.
There are steps you just cannot skip, even if you're feeling anxious. Like a comprehensive evaluation.
Meaning?
Looking at everything, your whole medical history, current condition, all the tests. Also, a thorough risk assessment, especially important, they say, for older patients or those with existing conditions.
Right, because their risks might be different.
Exactly. And then the basic preoperative preparations, things like fasting correctly, getting the right blood test, imaging. Skipping these is just asking for trouble.
Yeah, it's like building without checking the foundation. The sources even give points for a kind of pre-surgery evaluation checklist for you.
What's on it?
Things like truly understanding your diagnosis, why surgery is the recommendation now, getting a realistic idea of recovery time, making sure all the pre-anesthesia tests and fitness checks are done, and critically, having a plan for your care after the surgery before you even go in.
One bit of advice from Lifelines that really stood out to me was about getting a second opinion for major surgery.
That's a big one.
Yeah, and they frame it not as doubting your doctor, but as a way for you to gain more confidence, more clarity, especially for something high risk or life-altering. It's about informed consent, really.
Absolutely. And connected to that is just understanding the procedure itself.
Right.
You need to know the realistic expected outcomes, but also the potential risks.
Like what?
Well, things like anesthesia complications, infection, or delayed recovery. You need to be aware these things can happen and discuss them.
And speaking of discussion, a major the sources list is not asking enough questions.
Yes, you have to be your own advocate.
So what should you be asking?
The sources give a good list. Things like, what are the exact reasons for this surgery now? Are there alternatives we should think about? What should I expect during and right after? What are the specific risks for me, and how are we minimizing them? And crucially, how long is recovery really going to take, and what's the likely long-term result? Having those talks is presented as essential. Okay, now let's flip to after the surgery. The message here is just as strong, maybe stronger. Healing takes time.
Right.
The Navigating Surgical Recovery source is pretty direct, saying rushing this phase can have long-term consequences.
Yeah.
And mindful surgery breaks it down usefully. There's the immediate phase, like the first 0-3 days, mostly pain management, basic movement. Then short-term, maybe 1-2 weeks, wound care, slowly resuming some daily stuff. And then long-term, which could be 3 weeks to 3 months or even more, that's the real rebuilding phase, physio, nutrition, mental recovery.
And the sources list some common mistakes to avoid during recovery. Things that sound tempting, but are really bad ideas.
Like what?
Like leaving hospital against medical advice? Loma Hawaii.
Yeah.
You might feel pressure, but leaving too soon is risky.
Definitely.
Also, going back to work too early, skipping rehab or physiotherapy, that's huge. Or thinking just because the pain is gone, you're fully healed, that's a trap.
Yeah, the pain gone equals healed myth.
And a big one. Comparing your recovery timeline with someone else's, your journey is yours.
So true. Instead of those mistakes, the sources give smart recovery practices, positive things you can do.
Okay, like what?
Following your doctor's discharge advice to the letter. Sounds simple but vital. Maybe keeping a recovery journal to track things. Making all your follow-up appointments. Focusing on good nutrition, sleep, hygiene. The basics matter.
Using your support system too, right? Family, friends?
Absolutely. Lean on them. And maybe the biggest one, listen to your body. Get enough rest. When you do move, move gently. Avoid anything strenuous until you get the green light.
That point about listening to your body and not comparing is key because, as the sources stress, recovery is so individual.
Totally depends on you.
Yeah, your age, your health before surgery, the type of surgery, any chronic conditions, the quality of care you get, it all factors in. It won't look the same for everyone.
And just like asking questions before surgery is important, mindful surgery says ask questions before you leave the hospital too.
Like what to watch out for.
Exactly. What are the warning signs that mean you need to call or come back? What's the follow-up schedule? What can you eat? How much can you move? What should you avoid? And specifically, what activities are totally off limits for now? Getting clear answers makes that transition home much safer.
And just to quickly connect this back to the bigger picture.
Yeah.
The sources mention things that support this whole quality system, like the Supreme Medic sources talk about consultancy for hospitals,
helping them implement standards.
right? Helping them with things like getting NABH accreditation or just improving their operations. That directly builds the hospital's ability to provide the kind of quality care we're talking about, the kind that supports a good patient journey.
And that HospiMatch source, just by listing topics like specialized care, different therapies, medical imaging tech, it just shows how complex healthcare is. It highlights all the different areas where quality standards matter and where your journey, whether it's surgery or something else, interacts with the system. It's the whole environment that organizations like JCI and NABH are trying to improve.
So wrapping this up, what does it all mean for you? It means this push for quality through standards bodies like JCI and NABH. It's a really vital effort focused on making care safer and getting better results for patients.
Right.
And a really concrete, critical piece of that safety puzzle, especially with surgery, is your participation being thorough beforehand and patient during recovery.
The sources couldn't be clearer. Rushing, whether it's jumping into surgery unprepared or pushing too hard afterward, it doesn't actually save time. It actively risks undermining everything, jeopardizing your health.
Yeah.
Taking the time you need for preparation, for asking questions, for letting your body heal, that's not a delay. It's fundamental to successful treatment.
So whether you work in healthcare or you're a patient, navigating it, prioritizing quality, following standards, and respecting the time needed for evaluation and recovery, well, they're not just nice to haves. They're essential for safer, better care.
And maybe that leaves us with a final thought to chew on. If the goal of all this quality stuff is the best outcome for everyone, how do we as a system and as individuals balance that constant pressure for speed and efficiency?
Which is always there.
Always. How do we balance that with the undeniable need for careful individual evaluation and that sometimes slow patient process of recovery? It's a real tension, isn't it? Something worth thinking about in how we deliver and receive care.